Hi there. So for this week, we're talking about Gestalt and existential therapy. I hope I'm saying those right. I feel like both therapies this week were very similar. They have a lot of the same ideas about how to help clients. They both focus on self actualization and freedom, on being aware of your own thoughts and behaviors, especially with Gestalt focusing on the here and now. They both push for change and action. Both therapies feel that the therapist should be more of an observer than someone who analyzes the client. Gestalt has more techniques that have the client take a more active role in their self actualization, such as role playing different versions of themselves. The empty chair technique, for example, Gestalt and existential therapy at times encourages therapists to press their clients, and through their bluntness, the client can be more aware of the here and now. Existential therapy doesn't have specific techniques and has more general ideas than things to put into practice, rather than more focused like Gestalt. A limitation of the Gestalt theory is that although it is very well suited for individuals in multiple cultures, it can press a lot of feelings at once on certain groups of people in certain races or ethnic cultures who aren't used to, I guess, expressing their feelings quite so much. So it could be overwhelming for them. So that could be a limitation to the Gestalt therapy. Existential therapy is like Gestalt therapy in that it is good for individuals in multiple cultures. It is also well suited to individuals experiencing developmental issues or a life crises. But the downside to existential therapy is that it is vague and could be confusing for clients. It can also be too deeply focused on things that certain clients may not want to overcome at that time. Some clients may just want to talk about lighter topics and subjects. In the Handbook, Counseling and Psychotherapy, it says that existential therapy best mirrors the Bible's ideas of Christian faith. Existential therapy also talks about aloneness and death as if they were both inevitable, but if this is overdone, it could take out the hope of Christ completely. The Christian way of thinking about loneliness and death is to reach for Christ in our lives and become closer to Him. Gestalt therapy focuses on the here and now, which, if not careful, could leave out the future of Christ or even discount His atonement that was done for us in the past. Also, Gestalt emphasizes emotions more heavily than intellectual thought, which goes against Christian beliefs of finding truth through our thoughts. Gestalt therapy focuses on the individual and how the individual has no thought for those around them. This can lead to pride and overindulging of the self. For the last part, the last question, for existential therapy, there is a lot of focus on anxiety and overcoming it. A way to measure psychopathology could be to help the client overcome a part of their anxiety that keeps them from being with or around other people. And with Gestalt therapy, I suppose you could create a checklist when a client reaches certain awarenesses of their field or of the here and now, and how they have overcome certain thought processes that have kept them from achieving this. Those are my thoughts on existential and Gestalt therapy.